Health Services and Informatics Research Group has been very active in helping support our incident command and leadership through COVID hospitalization surge modeling throughout the pandemic so that we could know, relatively speaking, how many COVID patients we would have throughout the health system so that we could determine what types of resources we would need. And this has been and continues to be used. It's highly accurate, predicting out 3 weeks what our total COVID census will be. Another way that the Health Services and Informatics Research Group supported our clinicians during COVID was through a research team that was assembled to decide what treatments should be utilized. We had this interdisciplinary team that was reviewing all the literature to make sure that we were treating our patients with cutting-edge information. We worked with one of our internists here, Dr. Joshi, who was treating people who were in acute respiratory failure. And one of the treatments that are used for patients like that is called ECMO. And he had collected a lot of clinical data over the period of COVID and wanted to publish what he learned. So we supported his work by providing the statistical analysis and helped him write a manuscript that then was accepted for publication. Thus, Parkview was helping influence the treatment of COVID patients everywhere. So the ability to use our skill set from science to actually make an impact on patients' lives immediately has been really rewarding.
The laboratory had to change very, very quickly due to the pandemic testing changes and specimen requirements. So it was difficult for the lab because we aren't normally like that. We're very rigid and very procedure-driven. The staff have been very, very good with learning new things. We are very much more cross-trained. So we can move staff from one department to the other, from a phlebotomist to a processor, from Whitley County to PRMC. We've become more and more of a cohesive team. With the help of the state, we were able to purchase an analyzer that does PCR testing for COVID. So that was a very big game changer for our organization. It can do mass quantities of COVID tests. So we have done over 200,000 tests here in our laboratory for our entire community. And our team was fabulous in getting that up and running in record time. Our IT, our management, our scientists worked very, very hard to get that up and running and processes built and everybody educated in less than a week. But we are always looking at the cutting edge, what we should be doing, what we could be doing.
In pharmacy, and specifically within Parkview Health, we've had a centralized distribution process where all of the pharmaceutical products for the health system typically come in through PRMC and we distribute to the rest of the organization. And so we looked at what the criteria was for the monoclonal antibodies, what the supply was, and once we got to the point where there was enough supply in the market that we could afford to have inventory located at multiple places throughout the health system, we worked with our provider partners, our ED partners, and our walk-in clinics, actually. Our PPG offices and walk-in clinics are two of the primary sources for monoclonal antibody treatment recommendations. And so working with those stakeholders, developed a process to do monoclonal antibody infusions within the emergency departments. As the early fall, the wave that started in August came on and we hit some pretty astounding ED volume numbers. It was pretty apparent that if we could find a way to do those infusions elsewhere, it would relieve a lot of compression that was happening in our emergency departments, but also give us an opportunity to provide the patient a better experience. Our job from a pharmacy standpoint is to review emerging literature as fast as we can. Every source that we can think of to find information about what is coming and what is out and what the emergency use authorization, for example, what the verbiage in the emergency use authorization is that tells us exactly on who and how to use the drug. And so we take that information, combine it with what we understand about supply and establish the appropriate parameters for administering the drug.